This new video, and in today's video we're going to be speaking to you guys about the OET speaking exam. So the OET speaking exam, it's going to be between you and you're going to be playing a doctor, and then the interlocutor is going to be playing as a patient. So these are 6 steps which I want to get with you guys, and this is really going to help you guys break it down each part. So first of all, let's start with the introduction. You're going to be like, good morning, good afternoon, whatever. My name is Dr. Ahmed, and I am going to be the treating doctors at this suburban clinic, whichever clinic is mentioned in the card. This is our first meeting. How may I help you? This is our first. You're gonna start off with this. My apology. This may be our first meeting. How can I address you? So they're gonna be like, hey, my name is Mr. Newton. And then you're gonna be like, all right, Mr. Newton, how can I help you today? So that's gonna be. So you're gonna be like, how can I help you today? But don't say that. Be like, would you please tell me how I could help you today? So would you please tell me how I could help you? So you're going to use the word please, expand your sentences, and keep it perfect. So that's the first part. That's introduction done. Okay, so then Mr. Newton, he's going to be telling his things that he has fever, he has headache, he has sore throat, he has blah, blah, blah. Once he says that, you have to apologize. You're going to be like, I'm really sorry to hear that. I could imagine that it's very painful and very distressful. Would you mind if I could ask some further questions regarding the situation, if you don't mind? So you're gonna be like, can I ask you more questions regarding the situation, if you don't mind? And that extended sentences again will really be very good. And the reason you're gonna apologize and be like, I could imagine this could be very painful, very distressing, very stressful situation for you, is gonna show that you're gonna feel empathy for the patient. You're gonna have a lot of empathy, which is key marks for the OET. So the first thing, introduction. Second thing is, do apologize. No matter what, he's gonna have pain, headache, stomach pain, chest pain, I don't know. Apologize to him. Always apologize to him. Okay, perfect. Next is gonna be explanation. So you're gonna be over here. Well, based upon the symptoms and findings, I believe that you have acute, you can say whatever, pharyngitis, otitis media. Have you ever heard of that? And be like, no, doctor, I've never heard of it. I don't have any knowledge of this. All right, let me explain. So that's going to be over here. Now, once you explain to him, tell him that pharyngitis, it's going to be inflammation of the pharynx caused by group A, streptococcus, whatever. And you're going to be like, present sore throat, can present fever, whatever. Then you're going to be like, okay, you're going to ask him, am I clear so far? Is it clear so far? How does that sound? Do you feel comfortable with the advice? You're going to ask him, like, after you explain to him, ask him, do you feel comfortable? How does that sound? Do you feel comfortable with advice? Now they're gonna be like, yeah, I'm comfortable. And then, like, let's just say you have like a fat patient who maybe has high blood pressure and he needs to lose weight, and you can be like, Mr. Newton, I believe that in order the lifestyle modification is extremely critical, especially in your scenario. It'd be very important, very essential for you to do regular exercise, daily exercise, in order to reduce the hypertension, whatever. Okay, but so you're gonna be like, yeah, I completely understand with you. And the patient be like, no, I can't do exercise because I'm very busy, I'm really occupied, I'm very this, I'm very that. Okay, then what you want to do is, they're gonna be like, I completely understand your situation. However, your health is my priority, and what do you think is more important, your health or your job? So I would really advise you to do daily exercise, be that just running outside in the park, or maybe playing a aerobic or a high intensity sport, for example, football or basketball, or just simply going to the gym. I believe that these small steps of daily exercise is going to be really beneficial and really will benefit your health. And also you can be like, let me assure you, if you follow my advice, your chances of getting a heart attack will reduce. And if you don't follow my advice, your chances of getting a heart attack will slightly increase. So you wouldn't want that to happen, right? Increase chances of that. And then he's gonna be like, okay, yeah, thank you, doctor, whatever. And then be like, so do you have any other further questions? And be like, and the patient will be like, no, doctor, I don't have any other further questions. Then they're gonna be seen, or then it's gonna be like, if you had a small issue which you kind of fixed during that visit, just be like, okay, I hope you feel much better now. If you have some sore throat, some headache, whatever, be like, okay, I wish you a speedy recovery. And if you came for diabetes, asthma, hypertension, long chronic diseases, then just be like, just be like, I wish you good health with asthma. And then he's gonna be like, "Thank you, doctor," and you'll be like, "You're most welcome." If this written like the review visit is written on the card, just be like, "Here are my contact details. Please don't hesitate to contact me if you have any other further concerns." And if you're in a big hospital, be like, "Here are our contact details. If you have any further questions, please don't hesitate to contact us." So that's going to be the speaking OET. These are 6 essential things: introduction, apologize, explain to the patient, after explanation, give something. And if he's a reluctant patient, just tell him, you can reassure him, tell him that the chances of this disease is going to be, if you don't exercise, you wouldn't want that to happen. And first of all, completely understand him, and then kind of give him some advice like that. Conclude, be like, "Thank you, do you have any other questions?" He's like, "No." And then wish him good health, give him some good health, give him some good parting ways. And then once he's done, be like, "You're most welcome." So guys, that was OET. I hope you guys enjoyed this. More OET content coming soon. So thank you guys for watching. I hope to see you guys next time.